Just days after suffering a massive stroke that should have left him paralyzed and speechless, 77-year-old Paul Atkinson is talking and walking.
I'm very lucky. Very lucky that my wife has had the knowledge to recognize it's a problem and to get me speedy help.
I knew that when you see one side of the face that is totally, down, and his mouth was crunched in for one thing, he wasn't responding to my questions. I just picked up the phone right there and called 911 because I just knew he had had a stroke.
When we arrived on scene, we walked into the bedroom and found the wife holding the patient up against the bed. The patient was unresponsive, nonverbal, couldn't speak to us, couldn't move any limbs. His wife was just letting us know that she had found him like this. And then once we realized that he started having a facial droop and he had right-sided weakness, that we labeled him as a critical patient. We've been trained, and education teaches us to take him to the closest comprehensive stroke center, which at that time our closest was Medical City.
Farmers Branch paramedics, who knew Atkinson was likely outside the window to receive standard stroke treatments, bypassed 2 other hospitals to bring Atkinson to Medical City Dallas Hospital, a comprehensive stroke center.
So EMS chose Medical City because we're a comprehensive stroke center. EMS knew that this stroke was so severe that the clot-busting medication they normally use at a primary center would probably not work. So this patient was able to get the right treatment at the right time.
How are you today? Feel good?
He looked very bad. His NIH stroke scale, which is a severity scale we use, goes from 0 to 35 or higher, and his was 26. So very, very sick, and patients like him have about an 80% chance of not surviving a stroke.
Yet, at the skilled hands of Medical City Dallas Hospital's neurointerventionalists, Dr. Parita Buva and Alexander Venizelos, Atkinson underwent a highly specialized procedure to remove the blood clot from his brain.
Because EMS, the ED, the family recognized these symptoms very quickly, we were able to take him to a special kind of procedure where we can insert wires and catheters through the leg, tunnel them up through the body, and grab onto the clot and pull it out. Very few hospitals in North Texas, very few hospitals in the United States have this degree of comprehensive certification.
We are a comprehensive stroke center, and what's different about us is when patients come into us, we have a method where we look at advanced imaging and determine how much brain tissue is still left to salvage and how much has already died. And based on that, if there's a large area still to be saved, we go in and take the clot out and save that area of the brain, which otherwise would have died. A dramatic difference. Immediately on the table, Paul was able to start talking to us, start moving his right side, things that he was not able to do just minutes before.
I'm grateful that he was brought here to this hospital because they knew exactly what to do to save his life.
Paul Atkinson walked out of the hospital just 6 days after what should have been a massive, crippling, or deadly stroke.
It's a blessing. I'm very lucky.